The purpose of the Glenn procedure is to improve Sophie's oxygenation and reduce pulmonary artery pressure.
Any questions?
No. The operation is not without risk, particularly in light of Sophie's previous surgery. Each time you open the chest, it becomes more difficult. We expect Sophie's adhesions to be extensive.
But we are optimistic. She's a strong little girl.
Okay, thank you. Doing great.
They're great surgeons, Philip. Sophia's in the very best hands.
You know, it might just be because you're here, but I just think that everything's gonna work out.
Dr. Rhodes.
She's bleeding. Suction?
Suction.
It's coming from her right atrium. The adhesions in the sternum must have torn it open.
Damn it. Let's do a sucker bypass.
Sats are down to 52.
11 bladed and aortic cannula. I'm in.
Sats are up to 76, 80.
Prolene stitch for the SVC cannula. We need a new plan. There's no way to anastomose to the trunk of the artery. We need to attach further up the right side.
But if we don't attach to both sides, she'll only oxygenate half her blood.
It's a lot better than none.
She'll never set above 75 for the rest of her life. She'll be in heart failure by the age of 30.
Which can be controlled by medication.
Connor.
I won't let this girl die because we tried to bite off more than we can chew.
I know this is a difficult time for you. You've suffered a loss. But I have seen you do things in the OR that I did not think possible. This is not the time to back away from a challenge.
All right. 2 anastomosis sets. Let's move it. Snip. Time on pump.
3 hours, 14.
Should we take her off bypass?
How's she doing?
Pressure's good. Normal rate and rhythm.
Sets are at 88. She's going to make it.
Close if you don't mind.
Not at all.
Patient name, Glenn Simon, 57-year-old male, GCS 15, vital stable. Got knocked off his horse at the polo ground, gross deformity to the right femur.
All right, let's go to T3.
Mr. Simon, can you tell us what happened?
My buddy Harvey is a cheater, that's what happened. Trying to pull a 90-degree right off. Knocked me clear off my pony.
All right, let's get x-ray and call ortho.
Got it.
All right, let's move him on my count. Ready? 1, 2, 3. Mr. Simon, any pain?
Not there.
Okay. Oh, looks like you found it. Yep. Let's get him off the board. All right, on my count. 1, 2, 3. Gently. There we go. Get an IV started. Take a bolus of saline and 5 milligrams of morphine for the pain. We're gonna get you fixed up, Mr. Simon.
I never like to admit that my wife is right, but I'd be in a lot less pain if I stuck to golf like she asked me.
Mr. Simon? Mr. Simon, can you hear me? He's stroking. All right, give 20 milligrams of labetalol. Let's get him to CT and echo now.
Mr. Simon, we're taking you up to the surgical ICU. You understand?
Glenn, honey, I'm here. Glenn, Glenn,
Mrs. Simon?
why isn't my husband saying anything?
Mrs. Simon, I'm Dr. Rhodes. I'm taking care of your husband. Why don't we find somewhere where we can talk? So your husband has what is called a bifurcated vena cava. It allowed the emboli from his leg fracture to bypass his lungs and go straight into his brain. With your consent, I would like to operate.
I'd like to get a second opinion. Glenn has a partner who's on the board at the Mayo Clinic, and I'm sure he could refer us to a cardiologist there.
I understand. As long as he has the fracture, he is at risk of having another stroke. And we can't fix his leg until I fix his heart. Waiting could put him in even greater danger.
Fool still thinks he's 25 years old. I came here to give him a piece of my mind. And now this.
Mrs. Simon, we have a great team here at Gaffney. I believe when your husband comes out of surgery, he's going to be good and ready to receive a piece of your mind.
Okay.
Cooling jackets prepped?
Standing by.
Then let's do this. Scalpel. All right, go on bypass. Cool to 20, but do not crash cool. Find me when he gets to 32 degrees, and we'll arrest the heart.
Yes, Dr. Rowan.
Where are we?
Body temperature's at 20 degrees Celsius.
Flow down. Clamp.
Clamp.
Clamp is on. Give cardioplegia.
Leads is on. Heart's arrested. Start the clock. Stage is yours, Dr. Rhodes.
Mets and DeBakey.
Time?
6 minutes.
Precisely.
6 minutes, 11 seconds.
You still have another layer to go.
Damn it, more suction.
You have a clear line of the vessel suction is not your problem. You're not gonna make it.
I have plenty of time.
Not at the pace you're going. You've done 57% of the work and 81% of your allotted time. You are not gonna get there.
Your nonstop number crunching isn't helping.
30 minutes. That's what we agreed. That's what you promised. I'm taking over. Step aside, Dr. Rhodes.
I can do this.
Step aside. Dr. Downey may have been quick to put his faith in you, but my faith takes longer to earn.
I've been racking my brain as to how this bug got there. Gotta agree with Tom. You're the only person could have planted it. That day you gave me the AKG. I could tell you were nervous.
Ray, I swear I have never seen that thing before.
I can't tell you how disappointed I am.
I don't know what to tell you. Just know that while I was treating you, I was the best doctor I could be.
That sounds like a confession to me.
I wanted to give you the MRI results. You wouldn't answer my call.
Stop changing the subject.
Listen to me, Ray. You're slurring your words. Your balance is off.
Enough.
We need to get you in immediately. See a neurosurgeon?
Stop! You're not getting yourself out of this.
Hey, Pop.
No, Tommy, I'm busy. What do you mean he's in the hospital? You said Corcoran wasn't gonna be a problem.
I just found out myself. I thought I'd been taken care of.
We're not done here. I want answers.
Go get Bill. I know. Get him now! All right, I got this!
Come here.
Come on in.
Now.
He just collapsed. What the hell are we supposed to do?
Check him out, Will.
Ray, can you open your eyes?
Need a flashlight. Your phone.
Oh, God.
His left pupil sluggish. Ray, did you hit your head? He's unconscious. It's getting worse.
What does that mean?
He's not responding anymore. There's a bleed in his head, putting pressure on his brain. We have to get him to the hospital now. Call an ambulance.
Can't you fix him here?
You're kidding me. No. The pressure in his skull needs to be released.
Maybe we should take him to the hospital, Tommy.
Don't be an idiot. Okay, hospitals mean police.
But Pop is lying here.
No. I'm making this decision. Figure something out now.
I'm gonna need a few things.
Then do it.
Do the same with the bit.
Be okay, Pop. Just stay calm.
Pass me the drill.
How do you know where to put the hole?
His MRI. The hematoma was just about here.
It's just about? What are you guessing?
You want certainties? Let me bring him in.
Will? You better guess right.
Stop pointing that at me. It's best if my hands aren't shaking. Tim, I need you to hold his head as still as you can. There you go. If I go too deep, he's dead.
God. What did you do to him? What did you do to him, Will?
You all right, Pop? You're gonna be all right.
You sure we can't keep him here?
He has a hole in his head. He's at risk of infection. He needs an ICU and antibiotics. Easy.
Where do you think you're going?
To the hospital. I gotta tell the doctors what we're looking at.
No.
Tommy, I swear I'm not gonna say a word about this to anyone.
Stay here. Clean this up.
Wait! Tell the doctors he has a history of subdural hematomas. If they need to, they can call med for the MRI and keep him sitting up.
Ray, you might not be aware, but I'm a Navy flight surgeon still in active reserve. And Jeff here was an Army Ranger. Seen plenty of men screaming out in pain.
Tougher guys than me.
So, how about we take a look?
How about you suck me?
Ray.
Come on. Seen this movie before. Even when he says he has something lodged up his rectum.
Seriously?
See how he's hunched up on the gurney, trying to take the pressure off the rear end, plus all the lip. The embarrassment makes him come back.
All right. Try again, X-ray.
Thanks.
Ethan.
Yeah.
I thought we had a policy about dealing with poly and below coilomania.
Sorry?
The insertion of a foreign object into an orifice, all patients are supposed to be psychiatrically evaluated.
We got a bit of a mitigating circumstance here, miss.
The gun, exactly. To do what he did, this kid must be seriously troubled. And now he's alone and terrified. Are the restraints really necessary?
For the safety of everyone, yes.
Well, I want to go talk to him. How do we make that happen?
Ray, this is Dr. Reese. She's gonna help with the procedure.
Hello, Ray.
How much longer is this gonna take? Not too much. We're gearing up now.
Is it okay if I sit with him until we get started? If that's okay with you?
Sure. You can stay.
I like your tattoos. Who designed them?
Me?
You're really talented. You go to school for that?
No. Just fool around on my own.
Huh.
I saw you looking at my scars. You're not gonna ask me about them?
Do you want to tell me about them?
What, are you a shrink or something?
Not yet. Officially, I'm still training. Do you cut yourself, Ray?
I'm not crazy.
I know. What I'm discovering doing this is how we all do things that we can't explain. Things we say, things we do to ourselves. Maybe we're just experimenting, see how it feels. Or maybe we're reliving something that happened to us in the past. Did something happen to you, Ray?
Dr. Reese, it's your chore.
The hell is this? People are saying you're some kind of freak.
It's not what it looks like, Papa. It was for Wilmer.
Your cousin. That fool's in Crook County.
He asked me to smuggle a gun in for him. Said he needed it to protect himself. The guy in front of me beeped going through the metal detector. They tackled him to the ground. I guess I panicked. Ran out before they could search me. The pain must have made me pass out. Sorry. I know I messed up.
No. No, Mio. You done good. You tell him it was okay to remove it?
We'll have to put the procedure on hold.
Why?
Our patient just confessed to a crime. That means the gun is considered evidence. And since his father convinced him to withdraw consent, we'll have to secure a warrant to remove it.
We're gonna get started now, Ray. If you feel any discomfort, just tell us. I need you to stop moving your leg, Ray.
Where am I?
Just keep still, bud.
Almost there.
But
Jack! Gun vacated!
Go, go, go!
You okay, Jeff?
I'm all right. How's he?
Get pressure on that.
Exit wound in the right lower quadrant. We need a trauma lab. Pack the wound. Let's get him to the OR. Ready? 1, 2, 3.
All right, we're moving.
Let me take a look.
All right, watch your back. Coming through. We're gonna take him right to OR.
I hear they're gonna transfer you to the hospital at the county jail. I don't believe that story you told earlier. I know you thought it's what your father wanted to hear, but it would be a shame to go to jail for something you didn't do.
I'm not afraid of going to jail.
That secret you're holding on to just put a hole in your gut. If you don't open up, imagine what might happen next time. All you have to do is call, and we can keep talking.
You don't understand anything, do you? You want me to talk? Open up? And say what? That I'm some kind of freak? I'd rather go to jail. Forever.